Welcome to those who are here. Just wait a moment to see if more come in. We are getting started a little bit late, so we'll go ahead and get started. And for those who may be joining a little bit later, we will just have them join us as they get here. So my name is Dr. Amber Carter. I am a psychologist at the University of Kentucky Counseling Center, and I am here to talk to you today about test anxiety. My hope is that throughout this presentation, you'll feel comfortable participating and sharing some of your own experiences with anxiety, and I have some questions that I'm going to ask. So feel free to let me know if you have something you want to share. You can put it in the chat. We can unmute you so that you can participate. That would be excellent. Okay. Let me see here if I can advance the slideshow. Is not advancing. So let's see. There we go. All right, so we did some introductions. What we're going to do here today is talk a little bit about what test anxiety is, and then some strategies for managing or navigating test anxiety. So when we think about test anxiety, we think that this is a psychological condition in which people experience extreme distress and anxiety in testing situations. It should be noted that anxiety in a testing situation is considered to be somewhat normal. Most people experience some level of anxiety while they're taking tests. We just look at how much that anxiety is influencing or impacting the person, and we'll talk a little bit more about that later. Test anxiety is not a diagnosable condition. So, as a psychologist, we can diagnose things like depression, anxiety, mood disorders, all kinds of different things. But test anxiety itself is not a diagnosable condition. It's not listed in the DSM as a diagnosable condition. So, when people are coming into our office talking about test anxiety, we're looking at how is this impacting them? Are there other factors going on, like a generalized anxiety or social anxiety, perhaps? And then we just take a look at how can we help you to navigate the symptoms that you're experiencing. So what is test anxiety? I'm wondering if some of the participants would be willing to share maybe what they believe test anxiety is in terms of like physical symptoms, feelings, thoughts. What comes to mind when you think of test anxiety? Went too far. There we go. All right, I don't see anything in the chat. I don't see anyone answering question or trying to ask a question. So I'll just go through some of the things that we think of, right? So when we think of physical symptoms of test anxiety, we think of things like feeling on edge, feeling sweaty, feeling like your stomach is kind of hurting, trembling a little bit. Sometimes it's your mind going blank or having those experiences of not remembering in the moment. Some people might get headaches or nausea, shortness of breath. Your heart might be racing really fast. You might feel like you're on the verge of a panic attack, for example. In terms of emotional or feelings, really the fear of failure is the thing that we see most often with test anxiety. Some fear that I'm going to fail, or some fear that I'm not going to be able to do the things that I want or need to do on this exam. But other things might come up too, like anger, helplessness, disappointment, just feeling scared generally. And then some of the thoughts or some of the cognitive things that could happen is difficulty concentrating. So not being able to focus on the the test, not being able to focus on what's in front of you, thinking negatively about yourself or about the situation, comparing yourself to others. So you're seeing other people, writing a lot down, and you're like, oh no, why am I not writing a lot down? Um, all of those kinds of things, right? No, that's really, the thoughts that people have are really uh, they can be generalized somewhat, but I think everybody who experiences test anxiety has their own set of thoughts that might come up in those situations. So what is test anxiety? Just to go a little further into it, we think about it in three different phases. So it's a distress that's experienced before, during, and after an exam. It can come on in a number of forms. So sometimes it builds slowly. You start to feel like a little bit anxious, and then you start to feel a little bit more anxious, and then it just sort of builds over time. And other times it comes on suddenly and intensely. So we see this a lot with students who are like in the exam room with their exam. All of a sudden they start to feel like really nervous. They're sort of trembling and maybe sweating a little bit. And it can be anticipatory. So this is like, I'm worried about this thing that's about to happen, or it can be situational. I'm in this situation right now and I'm worried about what's happening in the moment. These two different types of anxieties and stresses should be coped with differently. We're going to talk about some strategies on how to navigate ways to manage test anxiety here in a little bit. But know that however you experience test anxiety, thinking about what do I need to do to cope with that particular kind of anxiety. When we think about like what causes anxiety, so sometimes if people come into my office and they'll be like, why am I feeling this way? Like, what is causing this? But that's really a hard question to answer. It could be acute factors, things that are happening in the moment, like not being prepared, or maybe having a hard day already, or maybe they're triggered by a thought that other people are doing better than them. It could be a variety of reasons. And then there's just vulnerability factors. So if there's a history of other anxieties, a history of test anxiety, a history of not doing well on exams potentially. Those are all things that could lead to some anxiety. Something that people may not always remember or think about is not getting enough like sleep, exercise, food. All of those things can also contribute to the experience of having anxiety in test taking situations. Okay. Any questions about that at all? I'll stop here for a moment and just see if anybody has any comments or thoughts. Mm. Okay, so Stephanie says this is really eye-opening so far. Thank you for this topic. That's great. Thanks so much for that comment. I appreciate that. Anything else have anybody else have anything that they would want to share? All right. So we talked a little bit about like the causes of anxiety, but let's talk about why we have anxiety. Anxiety is actually a really important emotion for us as humans. We have to have anxiety for us to be able to perform well in our environment. So a lot of times students will come to my office and be like, could you please help me get rid of all of my anxiety? I never want to feel anxiety again. I don't want to experience it. I just want it to go away. I would love to never have to experience this. And we have to do a lot of acceptance around anxiety when that is the goal or that's the purpose for coming into therapy because we can't make anxiety go away. We have to have it. This is the Yerkes-Dodson bell curve of anxiety. So if we take a look at it, we have performance on one side, and performance goes from weak to strong. And then we have arousal across the bottom here, which goes from low to high. Folks who experience low anxiety are in this area here where I'm circling, where they're at low arousal and weak performance. And so these are folks who are not really motivated. They're kind of just like laying around. You see this little stick figure sleeping. They're not kind of attending to the work or the things that they need to do. And then as you travel up the bell curve, you have increasing attention and increasing interest. Right. So up at the top of the bell curve, we have, a moderate level of arousal and we have strong performance. And this is where we want students to be while they're test taking. So we need a little bit of anxiety to get us to this point so that we can have a strong performance. Anxiety actually helps us to feel better in the moment, to feel alert, to feel like your interest is there, to feel focused. And so anxiety can be our friend and can be beneficial for us. And we really need it to be able to uh, do the things that we need to do in life. However, when we start to go down the slope and we have high arousal, we tend to have weak performance. So if we have too much anxiety, we have too many things that are making us nervous, we have impaired performance because of that anxiety. And so when I'm working with students to manage anxiety, we want you to go from this high level here up to this optimal level here. We're not actually trying to get down to this low level unless you're trying to like sleep or relax or something along those lines. But during a test, we want you to be up here in this moderate level of anxiety. Right. And so just having the knowledge that anxiety is supposed to be there and it helps you to, be motivated, it helps you to maintain focus, that can really be helpful in how you start navigating your relationship with anxiety rather than viewing it as an enemy. Think about it as a friend, somebody who's there to help you. And you can use some skills to help you sort of start in this high level anxiety and move it backwards if you need to. And sometimes you need skills to go from this low level of anxiety up to a more optimal level of performance. But for today's presentation, we're going to stick with sort of this side of the bell curve here. Yeah. Just for purposes of this presentation, we got started a little bit late. We're going to go ahead and skip this slide here, and we're going to go right to some of the other causes of test anxiety, which I shared would be helpful earlier. So what causes test anxiety? So we think about it in three different ways. We think about it behaviorally, cognitively, and emotionally. So behaviorally, what we think about is lack of preparation, not enough sleep, not enough exercise, not having a stable blood glucose level, or a healthy diet. It doesn't have to be a perfect diet, it just needs to be a little bit balanced. And then where I see a lot of students actually in this behavioral portion is with avoidance. So avoidance is a big thing when anxiety gets high. Anxiety gets high and you try to manage that through avoiding the tasks at hand. So that might look like not studying as much as you usually do. That might look like not opening the book to look at the things that you need to look at. That might be pushing off the exam or asking for an extension. Avoidance is a big part of what maintains anxiety in this behavioral portion. When we think about cognitive, we think about a negative self-talk. So I hear a lot of students saying things like, "Oh, I just can't do it. I'm not as smart as the other students. The other students have it easier than I do. I'm not good at this." We think about any sort of negative self-talk around the exams and how that might influence your perception of what's happening. Sometimes it's focusing too much on the outcome or what others are doing. So I hear students be like, if I don't get 100% on this exam, that means my future is going to be destroyed, or that means I'm not going to pass this class. And sometimes that's reality, but most of the time it's really not. And thinking about how others are doing. So sometimes I'll hear folks who are, especially if they're all in a room together, it's like, oh, I saw 10 people get up by 30 minutes after, and why wasn't I able to do that? And then for the emotional pieces, is there could be a disposition towards anxiety. So if you've experienced any anxiety in the past, you have a family history of anxiety, that might put you at higher risk for experiencing test anxiety. Past experiences of poor performance. So if you haven't done well on an exam in the past, and then issues outside of school. We see this a lot for our older students or students who are non-traditional age, who have other life factors going on. They've got family things happening. They might have children that they have got to take care of. We see it a lot with our freshman class even coming in where they're adjusting to being on campus, they're adjusting to being away from home. It's like all these things going on outside of the school, the test or the exams itself that might be playing a role in how you're feeling. I see a question here that says, do you frequently hear about test anxiety from students who learn fully online? And I would say yes. So I see across the board, students who are taking tests, I hear about test anxiety being a part of that. Sometimes the computerized tests give people a little bit more anxiety, especially if they're the ones that are like being recorded and like the movements are being recorded. That can really get to some people sometimes. They don't really like to be recorded, or they're like worried about what people are seeing, or if they make a wrong move or make a mistake. Um, and then something else I hear is like lack of support. So we're going to talk about that a little bit later, of like not having a group of people around or faculty members around who can help navigate how to study. Sometimes that can lead to higher test anxiety for folks who are fully online. And then people who are fully online tend to have more things going on for them. So a lot of folks are working full-time jobs, they're dealing with family stuff, just like I was talking about earlier. Some of those things really can contribute to test anxiety. Any other questions or any thoughts about the causes of test anxiety? Something paradoxical that I notice sometimes is preparing too much, right, can lead to test anxiety. So, um, really having that over focus on outcome and preparing a little bit too much can also affect your performance, which is kind of interesting. So, what do we do about it, right? How do we combat test anxiety if you're experiencing it? So, combating test anxiety before the exam, we think about preparation, right? So, what are your study habits? Are you prepared well enough in advance? Do you have a study schedule? Can you test yourself or others, right? Somebody who's fully online might not be connected to the people in their classroom and may not have people to test back and forth with or talk to about the things that are going on for them. And so, finding a way that you can increase your study habits can be really helpful to combat that test anxiety. Maybe reducing some of the avoidance of the difficult tasks too could be helpful. In terms of preparation for health behaviors, sticking to a regular sleep cycle can be really helpful. I recently went to a conference where somebody was talking about some research around sleep, and they compared folks who got a full night's sleep, those who got 6 hours of sleep, and those who got 3 or less hours of sleep. And as predicted, the ones who got full amount of sleep did really well on the tasks. They did like reaction time tests. And they did really well. Those who got 3 or less hours of sleep performed pretty poorly on those reaction time tests. But what was really interesting is that the folks who got about 6 hours of sleep also performed really poorly on the reaction time test, very similar to those who got 3 or less hours of sleep. But the difference was that they felt like they were performing well, whereas those who got 3 or less hours of sleep felt like they were performing poorly. They knew that they were not doing well. But those who got 6 hours of sleep were like, I'm doing great, even though they were performing at the level of not getting enough sleep. So, sleep is really an important piece to remember as you're studying and trying to navigate all of life's challenges. Eating regularly, making sure your blood sugar levels are stable. Exercise, even if it's a little bit, a 20-minute walk is said to be in the research equivalent to a dose of therapy or a dose of medication. So, getting outside and taking a brisk walk, it does not have to be like super hard, just like a light walk that gets your heart rate up a little bit. And then preparation in terms of self-care and relaxation. So engaging in positive self-talk. And I always encourage folks, sometimes the jump from negative self-talk to positive self-talk feels too big, right? So engaging in neutral self-talk. So rather than saying, oh, I'm going to do poorly on this exam, it's going to be awful. Sometimes it's too big of a jump to be like, I'm excellent at this. I know I'm going to do great. A neutral phrase could just be, I have an exam and I'm going to do the best I can. Right? To bring yourself into a way of thinking about the exam that isn't telling yourself, I'm going to do bad right from the start. And then engage in self care and relaxation. So, this can look however you relax or however you engage in self care. For some people, they forget that completing tasks or staying on top of these study habits and these different things can also be self care, right? So, I know for myself, doing my documentation at the end of the day, making sure that's done before I go home is a form of my self care because it sets me up for the next day where I feel better. So, it can look however you want it to look and be however you want it to be when we're talking about self care. Um, So, some relaxation strategies that we are going to talk about. These are things that you can do to help yourself relax in the moment. So, we know that relaxation strategies are going to be really helpful and important. And we're just going to go very briefly through some of these. So, soothing or grounding. So, getting out of your head and into your body. A lot of times, anxiety keeps us trapped in our thinking brain and a lot of thoughts going on about what's going to happen next, what's happening in the past, sort of like feeling really bad, and you get kind of stuck in that. One of the things that you can do is engage one of the five senses or more than one of the five senses. So you'll see this little diagram over here, this graphic, the 5, 4, 3, 2, 1 coping technique. And this is a way for you to acknowledge what's happening around you in your environment to bring you back into the present moment. So do this along with me as I talk about it, right? So as you're sitting there, just acknowledge five things around you that you can see. Right? What are 5 things that you can look at? So in front of me, I have a water bottle, I have a coffee cup, I have a computer, I can see the plant on my shelf back here if I look into my Zoom screen. I have a hand sanitizer bottle over here. There's a lot of different things that I can look at to bring me into the present moment. And then 4 things you can touch. So you can just pick some things up and start kind of like touching them, feel them, notice the texture of them, notice the temperature. 3 things that you can hear. This can be both inside the room with you or potentially outside of the room. I know they're doing construction on the floor above me. So a lot of times I'm brought into the present moment by drilling noises or by um, nuts and bolts falling on my ceiling. And so you can think about, okay, what do I hear in here and what do I hear outside of here? 2 things that you can smell around you. So maybe that is something that you are eating or drinking. Maybe that's a candle nearby, or maybe that is um, a plant or something that you've got near you, or some flowers you have near you potentially. And then one thing that you can taste, right? So this doesn't mean that you have to go out and taste something, but what flavor is in your mouth right now? Or like what can you taste? What sort of taste sensations do you have in your mouth right now? Um, Going along with that, if you wanted to bring a taste sensation to your mouth, there's a little bit of research that says that sour things help disrupt anxiety. And so having like a lemon head or a Sour Patch Kid or just like a slice of lemon can help disrupt some of that anxiousness because it brings our body back into the present moment. And then peppermint helps us to focus. So when I was in undergrad, one of our professors, one of my psychology professors, would give us a peppermint before each of our exams as a way for us to like help to focus. Did it help me in that class? I'm not so sure that I was prepared enough for it to help, but it was nice to have. So you might try some of those things just to see if they help you. Okay. Tip skills. So tip stands for temperature. Um, Intense exercise, paced breathing, and progressive muscle relaxation. So, with the temperature, we have what's called a dive reflex. And the dive reflex is that when our bodies are submerged into cold water, it slows our heart rate down. So, what they have you do for this exercise is to get a bowl of ice water and just have it there in front of you. And then you're going to dunk your face into that ice water and try to hold it there for about 30 seconds. If it starts to be painful, if it's too cold, obviously come up. And if you're on some sort of beta blocker or have heart issues, you might talk to your doctor first before doing this exercise. But the theory is that when you're anxious, your heart rate goes up, and the dive reflex, that part of you that gets activated when it thinks it's submerged fully in water, and especially cold water, will activate your parasympathetic nervous system and help that heart rate reduce, right? So it's kind of a trick of your body, right? But it's bringing you into the present moment. It's helping you to reduce your heart rate so that you feel better overall. Similarly, with paced breathing, let your belly do the breathing, right? So you are going to take really good deep breaths in. So you might practice this as I'm talking with you right now. I want you to take a really deep breath, right? You can feel your belly kind of moving or expanding out. It kind of feels like it's coming from the bottom of your belly. Take it in, you want to hold it and then breathe it out. The important part here too is when you're breathing out is that it's longer than your breath in. So you don't want to breathe in for like 10 seconds, only breathe out for 2 seconds. You want that to be reversed. You want to breathe in, you want to hold it for a moment and then breathe out as much as you can. For like little kids, and sometimes this helps with adults too, you might think about like blowing out a candle or blowing a bubble across the room or blowing out birthday candles or whatever it is, right? So you might think about that as you're trying to like breathe your breath out as much as you can. For those of you who might like to sing or be singers, think of Adele song. Like she has to hold those notes for a really long time, right? And so think about how you might hold your breath or your note for a really long time. What that does is it helps to increase our parasympathetic nervous system. It helps our heart rate to reduce. It helps us to feel more calm within our body. The research says that it takes at least 5 minutes of deep breathing to have any therapeutic effect. So sometimes I'll have students come in and be like, I deep breathed for 5 minutes and it didn't work. And I'm like, well, try to do it a little bit longer, right? Or I took 2 deep breaths and it didn't work. And I'm like, well, try to do it for at least 5 minutes and kind of see how you feel. Right? If you were doing some deep breathing as I was talking, let me know in the chat how that went for you. The iron tip is intense exercise. It's not listed on here, but it's just getting your heart rate moving actually. So for some folks, if you get up and take a flight of stairs or you do some jumping jacks or you do some push-ups and just get your heart moving, some a little bit of like brief, intense exercise can help your body to regulate itself a little bit. Your heart rate will go up, and then naturally after you're done doing exercise, your heart rate tends to regulate and go back down. And that sort of sensation or feeling can help you to feel better overall. And so you might try some of that. For folks who are studying, I often recommend the Pomodoro method. So that's 25 minutes of studying and then a 5-minute break with some physical activity. And that can help you to sort of regulate some of that anxiety if it's present there too, because you're getting some of that physical activity. And then finally, progressive muscle relaxation. So, progressive muscle relaxation is a way for you to send relaxation signals through your body. You start at the top of your head and go down to the bottom of your feet, and you tense each section of your body, not to the point that it hurts, but you might feel like a little tension. You might feel a little bit of like shakiness, or you might feel a little bit of maybe trembling or something like that. But it shouldn't hurt when you do it. And so you tense it, you hold that tension, and then you actively let that go. You tense it and you actively let that go. Bringing the tension to it helps your body to respond to the letting go or the relaxation um, in a way that's different than just trying to relax it without that tension. If you wanted to try or practice, which we were going to do, but I don't think we have time for that. If you want to try progressive muscle relaxation, there are a ton of them on YouTube. So if you go to YouTube and you just type in progressive muscle relaxation, a bunch of different videos will show up. You can do it for as short as like 5-minute videos, all the way up to maybe like a 45-minute video. For those students who have done this in the past, they come in and tell me that it helps them to feel more relaxed. They're getting better sleep if they do it before bedtime. And it just helps in a lot of different ways. Some of them are like, I didn't even realize I had so much tension in my shoulders. And now that I'm aware of that, I can hold my body in a different way, which helps me to feel a little bit better. Yeah. Any thoughts about some of these relaxation strategies before we move on? All right. Feel free if you're typing to continue to do that. I'll answer the questions as they come up or make a comment on what's said. But to move on here, so the next part of combating test anxiety is shifting that self-talk, right? So when you have a belief like I'm going to fail, your feeling is going to be fear, it's going to be anxiety, and then your behaviors might be things like blinking out, avoidance, sweating, feeling a range of different sensations in your body. And how we can kind of shift this for ourselves in a more targeted way rather than just being like, okay, I'm going to change the way I'm thinking, is to think about an activating event. So the activating event for us in this presentation would be you're going to do an exam. An exam is coming. There's an exam in front of you. It's going to happen. And then what you believe about that. So that's where that negative self-talk comes. And then you have consequences. So difficult emotions, sensations in your body, different behaviors that you might do. So some of these things that we talked about up here, the blinking out, avoiding, sweating. And remember that A does not cause C, so the event itself does not cause the consequences, but it's mediated by the beliefs, right? So the beliefs about the situation really come with the consequences. And so if you can shift some of those beliefs and the way that you talk to yourself about them, then you might have different consequences, right? So if you're going into a test saying, I'm going to fail this exam, how do you think that might fail or feel, right? Probably not great. It's probably going to feel kind of crummy. You're probably going to be really worried. You're probably going to be like, I think I'm going to fail this. But if you walked into that same test saying, this could be a challenging test, but I know that I'm prepared, right? You don't have to say you're going to do great. You can just say, I know that I'm prepared because you already did that pre-step that we talked about earlier, right? Imagine how you might feel at that point. Probably a little bit better, probably a little bit more um, calm, potentially. Right? Remember, anxiety will still probably be there. We want it to be there, actually. We just don't want it to be overtaking what you're able to do. Okay? Immediately before An exam, you can create a 5-minute de-stressing routine. So, some students that I've had that have done this will go for a quick walk. They will splash some water on their face or drink some cold water. They will close their eyes and just do some deep breathing or visualize themselves doing well in exams. They might put some lotion on their hands to see, like, okay, what does this smell like? To bring them back into the present moment. And again, doing like a peppermint or gum or some sour candy or something like that as a way to bring yourself back into the present moment could also be helpful. So think about for you in terms of, right before an exam, what might you do to help yourself navigate that exam? Okay. And then during the exam, take a break. So a lot of students are like, I don't know how I could take a break, but even just closing your eyes and not looking at it and doing some deep breathing and then reopening your eyes and re-engaging could help you get that little bit of a break. Have a cue for yourself to engage in that deep breathing. Start to build confidence, right? So you start with the easier questions and move on to the harder ones, or the ones that you start with the ones that you know and move on to the harder ones, the ones that you don't really know. And then use positive or neutral self talk. So remember, our thoughts affect our feelings and our behaviors and our physical sensations. The way that you talk to yourself is really important. And then after the exam, have some sort of positive activity planned, right? You worked really hard. You helped to support yourself, you studied, you put effort into this. And so have something that you are able to look forward to, even if you don't do well in the exam. I think it's important to reward the act of like, I actually did work really hard here and I did the best that I can. I'm still going to reward myself. And then later on, I'll think about how might I approach this test or this class differently in the future if needed. Take care of your body, so make sure that you're getting enough sleep, you're eating enough again, you're, doing the things that you need to do to take care of yourself, and then engage in some sort of relaxation or physiological de-escalation, especially if you're prone to experience some of the physical anxiety. So that might be like more deep breathing, it could be some yoga. That's really great for students as well, to just get some of that energy out at the end. So here, you can set a goal for yourself based on the things that we talked about today. So, if you want to take a screenshot of this, or if you want to just write in the chat if you want to, I can reduce my overall anxiety before the test by doing what? I can reduce my overall anxiety during the test by doing blank, and I can reduce my overall anxiety after the test by doing blank. Okay. So I'm going to leave this up here for just a minute or so, so that you can either write it down or screenshot it or potentially write in the chat how you're feeling. I see a couple of gratitudes about this presentation, so I'm glad that people are getting some information and feeling like it's helping. And that's always good to hear as a presenter. Um, And then know that there is additional support. So if you are a student at the University of Kentucky, know that you can come to the counseling center and talk with us about what your needs are. There are places like the study on campus, there's wellness coaching, there's academic coaching that you can be involved in as a student at UK that could help you either set up study strategies, get some additional support, all of those kinds of things. So I know that we are a little over time. I tried to keep it short. If we had a little bit more time, I'd have taken you through some of those exercises. But please feel free to go onto YouTube and utilize that. I know that UK is paying for students to use Headspace. So if you want a mindfulness app to help you come into the present moment, you can utilize that as well. But I'd be happy to take any questions or thoughts or concerns at this point, if you have any. I don't see any thoughts or questions coming in. So I just want to thank you for coming to the presentation today. I know it was a little bit rushed, but hopefully you got something from it and you're able to take some of these strategies with you into your next testing situation or really any stressful situation that you might have coming up. So thank you so much. Hope you have a good day. I'll stick around for a moment just in case there's any additional questions. All right. Thank you so much. I hope you have a good day.
Bye.
We'll see you. Bye.